This is the next case in our acute subdural hematoma case series, and this is an example of another difficult to detect subdural hematoma, and we're going to focus on the fundamentals again. The first thing we're going to do is window for success. So this is a preset that I have on this particular PACS, which is a 6160, and then I'm just going to kind of adjust it a little bit to make it a little bit more helpful for seeing things on this scan. And I'm just going to let you know off the bat that this is going to be one that's much more obvious on the coronal, not the axial. So it actually exists right here, and I know that because I'm familiar with the case, but also you may be able to appreciate how the brain parenchyma is pushed, a little bit away. So this is displaced gyri here. So there's something extra, but we're not just going to make the finding there. If we go to our coronal, again, we're going to do our subdural window. This is the preset 6160 that I have. I'm just going to adjust it a little bit, see if I can find it to be a little bit more helpful. So that's just a slight adjustment, but I think this actually makes it a little bit more obvious, where as you scroll and compare the left to the right side, what you'll see is there's something a little extra right here. And as you scroll through, you'll see that that's actually subdural blood around the frontal convexity here that's pushing away the brain parenchyma. And that, again, it's very difficult, but this is the subdural right here, and this is normal brain parenchyma, which has been pushed away. And then if you look on the other side, there is nothing that really corresponds to that. The gyri come all the way to the convexity there. So that's a little subdural, probably late acute, subacute, given its density, but probably an acute component given that this patient presented with trauma. So this is an easy to miss subdural, and sometimes it's literally that subtle, and that's all you get, and you have to make the finding. So again, you want a window so that you can see this. If I go back to a standard brain window, you're never going to pick that up. And then you want to be able to also look at your coronals here to help you make the finding, because it's going to be incredibly difficult to pick this up on the axial confidently.